Medicare is a government health insurance program for seniors and people with disabilities. Medicare coverage is broken up into different parts. Each part has different costs, but there are programs that may help you pay for those costs. Medicare Part A is hospital insurance and pays for your medical care when you are staying in a hospital. For most people, Part A is free, but you do have to pay a yearly deductible if you are hospitalized. If you haven't paid Medicare taxes through a job, you may still get Part A by paying a monthly premium. Medicare Part B is medical insurance and pays for visits to your doctor, lab tests, scans, medical equipment, and IV chemotherapy. Medicare Part B has a monthly premium based on your income level. You also have to pay a yearly deductible and 20% for any medical care you get. This is called coinsurance. Parts A and B together are called Original Medicare. Medicaid is another government health insurance program for people who have low incomes. In some states, you also have to have low resources. Resources include money in a bank account or retirement account, like a 401k plan. Resources do not include your home and one car, furniture, or household and personal items. If you qualify for both programs, Medicaid can help pay for things Medicare doesn't pay for and lowers the costs you have to pay for Medicare. For more information about Medicare and Medicaid, visit triagecancer.org. If you don't qualify for Medicaid, you may qualify for one of 4 Medicare savings programs. These programs have different rules and can help pay for Medicare premiums, deductibles, co-payments, and coinsurance amounts. The first Medicare savings program is called the Qualified Medicare Beneficiary Program. This program helps pay for Part A and Part B premiums, deductibles, and co-payments. But it only helps people with a very low income level. The Specified Low-Income Medicare Beneficiary Program and the Qualifying Individual Program both help pay for Part B premiums, but allow you to have a higher income level. The fourth Medicare savings program is called the Qualified Disabled and Working Individuals Program, which helps pay for Part A premiums. The income limit for this program is higher, but the resource limit is lower. This program only applies to people who are working, have a disability, are under age 65, and now have to pay a premium for Medicare Part A after returning to work. If your income is too high to qualify for the Medicare Savings Program, there are other ways to lower out-of-pocket costs for your medical care. If you have Medicare Parts A and B, you may be able to buy a supplemental plan called a Medigap plan. Medigap plans are additional plans that you buy from a private insurance company by paying a separate monthly premium. But Medigap plans can save you money by paying for your out-of-pocket costs under Part A and B, such as deductibles, co-payments, and coinsurance amounts. If you are not able to afford a Medigap plan, you can consider a Medicare Advantage plan or Part C plan. Part C plans are sold by private insurance companies. The monthly premium depends on which plan you choose. Part C plans have a cap on how much you have to pay out of pocket each year. You may also need help with the cost of your prescription drugs. If you have Original Medicare or Medicare Advantage plan that does not include prescription drug coverage, you should consider buying a Medicare Part D plan to pay for your prescription drugs. Part D plans are sold by private insurance companies. Your Part D monthly premium will depend on the plan you choose and your income level. Part D has a deductible, which is an amount you pay first before the plan starts to pay for your prescription drugs. After you pay the deductible, Medicare pays 75% of your drug costs and you pay 25%. Then, when your out-of-pocket drug costs reach a certain amount, Medicare will pay 95% of your drug costs. If you need help paying for your drug costs, Medicare has the Extra Help Program, also called the Low Income Subsidy. Based on your income and resources, the Extra Help Program will pay Part D premiums, deductibles, co-payments, and coinsurance amounts. If you qualify for the special low-income Medicare beneficiary or qualifying individual programs, you automatically qualify for extra help. If you don't qualify for extra help, your state may have a state pharmaceutical assistance programs, or SPAP, to help pay for Part D premiums or drug costs. For a list of these state programs or other help with Medicare, call 800-MEDICARE or visit Medicare.gov. For more information, visit triagecancer.org and cancerfinances.org.